Okay,
Yes, sir.
so its length is twice than that of the second, twice that of the second rib. Its length is twice that of the second rib, and its shaft is sharply and highly curved. Sharply and highly curved. This shaft, and its shaft is not twisted. Hence, the first point is explaining that it has length is twice than the first rib mainly. So the shaft is sharply and highly curved, and its shaft is not twisted. Its shaft is not twisted, but as we saw in the typical rib, the shaft is twisted. Hence, both the ends of the rib touches the tabletop when placed on it. Near its middle, the outer convex surface of the shaft presents a rough impression or prominent tubercle, which provides attachment to the serratus anterior muscle. You can see the serratus anterior muscle in the picture. Serratus anterior muscle. Can you see? Can you
Yes,
see the
sir.
serratus anterior
Yes,
muscle
sir.
at the just uh, at the end of this muscle? You can see at the right picture.
Yes, sir.
Okay, so near its middle, you can see the serratus anterior muscle, and the outer surface of the shaft is directed outwards and upwards, and while inner surface of the shaft is directed inwards and downwards. Posterior part of the internal surface presents a short costal groove. Posterior the part here, posterior part of the inner surface. Inner surface has two parts, posterior and anterior part. In the posterior part, you will get the intercostal groove, where in the typical rib there was the costal groove at the middle part of the shaft, but here it is at the posterior part of the shaft. So posterior part of internal surface presents a short costal groove, and the upper border of the and adjoining part of the upper surface provide attachment to the scalenus posterior muscle and serratus superior muscle. Posterior superior muscle. So three muscles. Don't confuse with them. Three muscles. One is at the middle, which is serratus anterior muscle, and the other two is at the upper border, which is one of them is scalenus posterior muscle, and another is serratus posterior and superior muscle. As you said, at the middle there is serratus anterior, so serratus posterior superior is at the upper border. So serratus anterior, serratus posterior, and another is scalenus posterior. Okay. So 10-3.
Yes, sir.
Distinguishing feature is it has single articular facet on its head. 10-3, you can see in the picture 10-3 at the left, and there is a single articular facet on its head, which is articulate with the body and corresponding thoracic vertebra. It is slightly shorter than the typical rib, as you can see. As you know, just it lies just before the 11th and 12th ribs. So okay, so attachments are near the tip. It provides attachment to the latissimus dorsi muscle. Which muscle? Say someone. Latissimus dorsi.
Latissimus dorsi.
Dorsi. It's another muscle. Latissimus dorsi. It's like the muscles names are like tongue twister. But when you will do it several times, when you will say it several times during listening and during reading, you will it will be habituate to you. Okay, make it habituate to you. Don't worry about the muscles names. Latissimus dorsi muscles above and external oblique muscle below. External oblique muscle below. As you know, external oblique, internal obliques, all those muscles are attached with the ribs and also our abdomen. You will get it in the abdomen part. When you will go to the abdomen card, you will get it in the abdomen part. Now we are going through the thorax card, and just remember the name external oblique muscle, which attaches with this 12th thoracic vertebra. Near the tip, it provides attachment to the latissimus dorsi above, and its medial half provides attachment to the erector spiny muscle. You can see the picture. Erector spiny muscle. Can you see the attachment? Can you see the erector spiny muscle?
Yes, sir.
Remember those names because you will get it several times when you will get with the other cards, and you will get. So when the covering of the lungs is as the covering of the lungs is attaches with the 12 ribs, just touches with the 12 ribs, there is a attachment. So some of the reflection is seen in the 12th rib, which is the reflection of pleural, which is the reflection of the covering of the lung, that is the pleura. So lower part of the medial half provides attachment to the quadratus lumborum muscle. What is the muscle name? Please say. What is the muscle name?
Quadratus lumborum muscle.
Quadratus lumborum.
Quadratus lumborum muscle. Okay, as you can say quadratus, that means quadruple. That it may have four heads or four of the origins or insertion, anything which is related to the quadrate, that means four. Okay, so just remember like this: quadratus, that means four. Quadratus lumborum, that means where the lumbar area, that means we have lumbar vertebrae, lumbar region in our body, in the abdomen. So that lumbar region is similar to the lumborum. So as this is at the same level, so this is called lumborum. So quadratus lumborum muscle, you can remember like this: quadratus lumborum muscle. Okay, then middle to fourth near the upper borders provides attachment to the internal intercostal muscle, and upper part of the lateral 1/4 near the tip provides attachment to the diaphragm. Attachment to the diaphragm, that is the end of the thoracic outlet that separate the diaphragm separates the thorax from abdomen. Okay, and it's also a respiratory muscle. Diaphragm, the diaphragm is a respiratory muscle that helps in respiration, inspiration and expiration. So lower border, in case of lower border of the 12th thoracic vertebra close to the head, it provides attachment to the lumbocostal ligament. So this ligament attaches with the, as we know, the ligaments name are almost similar to their attachment. If one is goes to the lumbar region, and one is attaches to the coastal region, that means coastal vertebra, coastal region, that means ribs. So the ligament which attaches with the lumbar vertebra and coastal rib, that means lumbocostal ligament, that is called lumbocostal ligament, which stretches from the transverse process of the lumbar 1 vertebra, which stretches from the transverse process of the lumbar 1 vertebra. As I said, lumbar 1 vertebra, as it is come from the lumbar 1 vertebra, so its name is lumbocostal. And we have another ligament that is at the lower border, that is lateral arcuate ligament. Lateral arcuate ligament is attached to it, just lateral to the quadratus lumborum, just lateral to the quadratus lumborum muscle. As you know, quadratus lumborum is attached at the inner surface, so just lateral to the quadratus lumborum there is lateral arcuate ligament. So there is two ligaments. One is the lumbocostal ligament, another is the lateral arcuate ligament. So upper border, again upper border provides attachment to the external and internal intercostal muscles, as you know, as like other vertebrae. It has also external intercostal. Yes.
Sir, can you again repeat that second one point? That lateral equatus ligament.
Lateral arcuate ligament.
Sir, what is that arcuate means? Which is attached through which one?
Yes.
Sir, can you explain once again?
Lateral arcuate ligament. Lateral arcuate ligament is just lateral to the quadratus lumborum muscle. Quadratus lumborum muscle, as I explained in the inner surface, it is attached just lateral, not so far, just lateral to the quadratus lumborum muscle. There is a ligament. It is called lateral arcuate ligament. Arcuate means it is a arcuate. There is an arcuate line. There is an arcuate line in the abdomen. You will see in the abdomen part there is an arcuate line which differentiate the muscles attachment of the abdomen. So this line, this ligament comes, this ligament attaches with this part and with the arcuate ligament also, arcuate part also, arcuate line also. So that's why its name is lateral arcuate ligament. So just remember the lateral arcuate ligament is just lateral to the quadratus lumborum muscle. Okay, that's all. And upper border. The upper border provides attachment to the external and internal intercostal muscle. As you know, other ribs also attaches with this. Ossification point. All the ribs ossify by 4 centers except first, 11th and 12th. Okay, first 11 and 12 ribs, except the first 11 and 12 ribs, all the ribs ossify by 4 centers. 1 primary center for shaft, 3 secondary centers, 1 for head, 1 for articular part of the tubercle, and 1 for the non-articular part of the tubercle. First rib ossifies as a typical rib, first rib ossifies by three centers: one primary centers for the shaft, two secondary centers, one for the head and one for the tubercle. 11th and 12th ribs ossify by the two centers each, one primary centers for the shaft and one secondary centers for the head. And primary centers of all ribs appear at the 8th week of intrauterine life. That means during uterine life, before birth. So secondary centers of all ribs appear at at puberty. That means in case of male, the puberty may be at 14 to 16 or 12 to 16 years of old, and in case of female, there may be 10 to 12 years old. There may be puberty. So in case of puberty, during the puberty, the primary centers of all ribs appear at the 8th week. During the puberty, the secondary centers of all ribs appear. So fusion in all ribs occurs at the age of the 20 years. So all ossification centers gets developments all these periods, but fusion in all ribs will become at the 20 years of age. There is cervical ribs, lumbar rib fracture, or there is a clinical correlation. The cervical ribs. Okay, I will teach the clinical correlation in the next class, inshallah. After this ossification, you will read through and you will go through with the previous classes also, so that I can ask you from all those part of the thorax. Okay. Next, in the next class, we'll go through with the thoracic vertebra. And in clinical correlation, you will go through with this. But if you understand, if you don't understand, you will ask me, and I will also explain about the clinical correlation of the ribs in the next class also. And thoracic vertebra will go through it in the next class, and we'll complete it, inshallah. And we have, then we'll go to the thoracic muscle mechanism, the thoracic wall and respiratory muscles like diaphragm and all this, and also intercostal nerves, artery and vein also. Okay, thank you all. Thanks for attending.
Thank you, sir.
That's all.